Hello, today we will be performing a pelvic exam. Prior to starting the exam, please ensure that you have the following items: a drape, gloves, speculum, lubricant, a cotton swab, GC chlamydia swab, a specimen container, a cyto broom, a spatula, and a cyto brush. You may now begin the exam. Hi ma'am, my name is Dr. Ergasheva and I will be performing a pelvic exam on you today. Throughout the exam, I will be providing orienting statements, but please, if at any point you feel uncomfortable, do not hesitate to let me know, okay? The first thing I'll do is adjust the table. I will then proceed to put this drape over you. I will then adjust the stirrup to make sure that you are comfortable and illuminate the field with a light source. I will then place on some gloves. For the first portion of the exam, I will be assessing the vaginal area by both looking at it and feeling for any abnormalities. I will be mainly using my two right fingers. I will now be touching you. So the first thing I'm doing is separating the labia. I will now assess the vaginal glands, starting with the Bartholin glands located at the 5 and 7 o'clock positions. I'm now assessing the skein glands at the 11 and 1 o'clock positions, as well as assessing the urethral meatus. For the next portion of the exam, I will be using the speculum. I will go ahead and lubricate it. This portion of the exam may feel cold and uncomfortable, so I apologize in advance, okay? I will now place my left hand on your leg, and I'm slowly inserting the speculum at a 45-degree angle. I have visualization of the cervix, so I will now lock in the speculum. The first thing I'll be doing is using this cotton swab to wipe away any of the discharge. Next, I'll be collecting a specimen for two specific infections, chlamydia and gonorrhea. I now put it in, rotate it 360 degrees, and wait for a few seconds. You're doing great, ma'am. I will now collect another specimen. And for this, I will be using what we call a cyto broom. It is now going in. And I will just rotate it 5 times. Great. That concludes the speculum portion of the exam. I will now unlock the speculum and slowly take it out. Great. For the next portion of the exam, I will be using my two right fingers. I will now go ahead and lubricate them. And I will be placing my two right fingers in the vagina, going in vertically right now. The first thing I'm doing is assessing the vaginal walls. Now I will assess for cervical motion tenderness by lightly tapping on the sides of your cervix. Any pain? Any pain? Now I will assess for what we call a cystocele by pushing up with my two right fingers. Go ahead and give me a cough. Good. I will now assess for what we call a rectocele by pushing down on my two fingers. Go ahead and give me a cough. Great. The next portion of the exam, I will be assessing the height of your fundus by pushing down with my left hand and pushing up with my right two fingers. Great. Now I will assess the adnexa by once again pushing down with my left hand on the lateral sides of your pelvis and pushing up with my right two fingers. Okay. The next portion of the exam requires me to take one finger out and place it in the rectal region. I apologize, this may feel uncomfortable, but please push down as if you're having a bowel movement for me. I am going in now, and I'm assessing the pouch of Douglas. Great, ma'am. Thank you so much for being cooperative. That completes the pelvic exam.